that the uterus is such a vascular organ that it will continue to feed the tumor until it can grow to be twice the size of a watermelon.
So you've experienced seeing tumors that size?
Oh, absolutely, twice the size.
Hello, everybody. Josh Rubenstein, Media Director for Kaiser Permanente, Southern California, and this is another KP Candid Conversations. These are conversations with our physicians, our staff, our experts about important health topics, but more importantly, we talk about what drove them to healthcare. Why pick this profession? Why KP? And today we're talking about robotic surgery, robotic myomectomy. This is critical for women who have fibroids. It's a way to actually do that surgery in a minimally invasive way. And it is quite literally life-changing. We're talking to Dr. Meredith McMullen from our San Diego service area, who became interested in this technology early on in her healthcare career. But it was a trip to Africa that really changed her perspective on healthcare. Dr. McMullen, first of all, tell me a little bit about yourself. How did you become a doctor? Why did you become a doctor?
Well, thank you for asking that question. It's been quite a wonderful journey for me. I'm originally from Boston, Massachusetts, and I had the opportunity to do some traveling to Africa, actually, when I was a teenager. I returned when I was in college to work with HIV-positive children and kind of got very interested in the maternal-child relationship. Specifically with how it related to HIV transmission. But my interest then further developed into looking at the maternal environment for pregnancy. And then I sort of got bitten by the bug once I got to medical school. And OBGYN was such a passion of mine. I could not walk away from it. It's a true calling. And so once I was in medical school and residency, I never looked back. It's always been OB and GYN for me. And then I started to become exposed to GYN surgery, which is a whole nother portion of this field. And laparoscopy and robotics just kind of exploded my imagination. And so from there on, it was, the rest is history.
Well, so it sounds like there are two things here, right? There's the technology of being able to do this kind of a surgery in a less invasive way, right?
Yes.
But it's also caring for women and the female reproductive systems, correct? Absolutely.
They fit hand in hand. They seem like they're kind of two separate things, but the female reproductive tract is just, the uterus, the ovaries, the fallopian tubes they're very dynamic organs. And so, in addition to supporting life and bringing life into the world, there are other pathologies that can happen in terms of the GYN aspect of things. And so once I started to kind of develop more interest in that and get more exposure to that in residency, I decided to apply for fellowship, which is what actually brought me out to Scripps La Jolla for my fellowship, and then Kaiser afterwards, where I spent 2 years just doing GYN surgery and got so much exposure to the different pathologies that are involved with the uterus, and things like fibroids, which are benign tumors of the uterus, just have so much variability in terms of how they present and how they impact patients' lives.
I want to go back to the journey to Africa and how it has imprinted you and what in your work. Tell me what was it about that trip, about that experience, that shapes the doctor that you are today?
Well, I would say looking at maternal conditions, looking at the societies that sort of impact our maternal welfare, and how that impacts bringing children into the world. It's sort of like women are sort of like ground zero in terms of how we improve lives for babies and children. And if you can't improve the life of the mother, the health of the pregnancy, her access to healthcare, and adequate support during pregnancy, then you're so much further behind in terms of how we can impact our infant mortality and support babies and so that they can grow into healthy children and healthy adults. So from my perspective, it very much starts with the maternal child care and health care.
That's such an interesting perspective that the source is taking care of women. If we can figure that part out, then it improves everything, right?
Absolutely. Absolutely.
Yeah. So you do your work and then you come into this world of robotic surgery.
Fibroids are the most common benign tumor in a woman's reproductive tract. It's so common that 1 in 10 white women will get them, but that number jumps to 1 in 4 for black women. And inside Kaiser Permanente, the removal surgery is not your typical myomectomy.
I got my fibroids removed 8 weeks ago, March 27, 2023.
Tamika Lopez underwent a robotic myomectomy to remove the fibroids she found about 10 years ago when she had a miscarriage.
They started off really, really small, and 10 years later, when I discovered I was having problems with them, they were the size of small grapefruits, large oranges.
Tamika had 18 fibroids causing her pain.
For those of us, please let us understand the difference between something that is invasive, that is a traditional surgery that we know of with a scalpel, and then this concept of doing it in a way that doesn't cause that kind of damage to the body.
Yes, that's a great question. So traditionally, hysterectomies that were performed for complicated indications like, massive tumors or heavy bleeding, they were all performed under open laparotomy incision. Okay, and so fibroids can grow to be all different sizes and shapes. And so my specialty is managing fibroids and how they impact women in terms of symptoms. But oftentimes these tumors get to be so large that the only approach is to do the surgery and remove the tumors through a large laparotomy, which can be, a foot long. Okay. And oftentimes these were vertical incisions so that we could have access to the blood supply that is feeding these tumors and the uterus. And so this was, basically committing our patients to overnight stays in the hospital that lasted for days. It committed them to needing narcotic medication for extended periods of time. It was associated with a higher blood loss during surgery and just a much higher morbidity. So we would see a higher incidence of infections with laparotomy incisions and higher blood loss during the surgeries. And what robotic technology has allowed us to do is basically approach these very complicated situations and complex anatomy-wise through doing small incisions and basically providing a minimally invasive alternative. And this alternative allows our patients to go home the same day. They're on narcotic medications for maybe a day or two, and the rest of the time it's Motrin and Tylenol. They don't develop the same scar tissue internally, which is called adhesions. And so we see a much lower incidence of scar tissue and adhesions after doing minimally invasive surgery when compared to laparotomy. So there's just a multitude of benefits, not to mention the fact that the recovery time is a fraction of what it is for invasive laparotomy incisions.
And you're dealing with, when we're talking about tumors, what are we talking about, and how does it form, and what do you run into?
So these tumors, they're extremely prevalent. About 1 in 10 Caucasian women have fibroids. 1 in 4 African American women have fibroids. So, the incidence, we're talking about millions and millions of women. Okay. And a lot of the time, these tumors are not symptomatic. Okay. Because they're so small, they don't make an impact. But the other percentage of the time, they start to grow and cause things like heavy bleeding and painful menses, painful intercourse, problems with bladder function. And so, these tumors can become quite a problem. And that's typically what drives people to come in to see me in the office is, they've gotten to the point where they're bleeding so heavily, they need blood transfusions. It's not uncommon that every week I have somebody walk into my office that requires blood transfusions because these tumors are so large.
What happens if they're untreated?
Well, typically people end up seeking.
Or you have to.
Yeah, because you bleed so heavily that you'll become anemic and you can't function. You'll pass out. It's just, very dire consequences. And so even people who are reluctant to come see a doctor, they eventually come see me. And oftentimes the tumors are massive at that point.
You have a visual kind of example so that we get an understanding of the range that you're dealing with, right?
Yes, yes. So they can be as small as grapes, and they can exist throughout all the different layers of the uterus. Sometimes these ones that are small as grapes, most of the time they're not symptomatic unless they're on the innermost portion of the uterus, called the submucosal layer, in which case a very tiny one can cause very, very heavy bleeding. They can grow to be, apple size, which again, sometimes these are not symptomatic. If they're in the muscular intramural portion of the uterine wall, then these are not going to necessarily cause an issue.
Seriously, something that size is not going to cause some kind of symptom that you would know?
Oftentimes these are completely
Shocking.
asymptomatic. Yeah. The trick is that the uterus is such a vascular organ that it will continue to feed the tumor until it can grow to be twice the size of a watermelon.
So
And
you've experienced seeing tumors that size?
oh, absolutely, twice the size
Wow.
on a routine weekly basis.
Unbelievable. And
Yeah.
are these tumors cancerous? Are they benign?
They're benign, by and large. The incidence of cancer is like, 1 in 1,000. It's very, very small. And so these large majority of them are benign. And oftentimes, you can predict based on the behavior of these tumors, whether or not they've been present and slowly growing over a long period of time. These are all indications that that's a benign tumor.
And I assume when you're talking about this less invasive approach to dealing with this, it's pretty important because you're dealing with something that is relatively emotional as well, right? This is a woman's reproductive organs. If you're doing a hysterectomy, if you're doing something that's going to, potentially inhibit the ability to have children, it's already an emotional experience. So the more you can do to keep things intact and make it easier, I assume the better.
Absolutely. A lot of times in the past, and in the relatively recent past, women were not given options for a myomectomy, which is removing the tumor itself and leaving the uterus intact. They would present with these enormous tumors and heavy bleeding, and they were told, you need a hysterectomy. And so there are many women who feel that their fertility windows were cut short because we didn't have the technology to offer, the ability to remove the tumors and leave fertility intact. And now we've been able to, at Kaiser, since starting this program, we've done hundreds and hundreds, over 300 of these surgeries, where women are keeping their fertility intact while we're addressing these major symptomatic fibroids.
And how important is it that we reach out and ensure that communities of color have access to this type of procedure, to this type of care?
I think it's critical. I think that this is one of the major impacts in terms of quality of life that we see with our patients. And a lot of women are reluctant to come forward. They don't want to complain. I can't tell you how many people I see kind of suffer in silence until they just are forced to, because, they're at the end of the line in terms of what their body can handle. And for Black women, 1 in 4 of us have fibroids, and that's just, a much higher incidence than we're seeing. And, science is not really sure why that's the case. Why is the incidence so much higher? And what is it that makes these fibroids grow? Ultimately, this is a cellular DNA issue where you have a fibroid that, develops the potential in terms of its cellular life to continue to divide and grow and grow and grow. What makes it non-cancerous is that it doesn't spread. Okay, so it stays in the uterus, and oftentimes there are multiple fibroids within one uterus. I think the most I've ever removed robotically is 44 fibroids in one patient.
Wow.
And she got up and went home the same day. It's like the recovery and the surgery itself is just much more straightforward and elegant than our traditional laparotomies.
So what can we do to reach out to Black women to ensure that they understand that there are options and that you can get this kind of procedure done?
I think education and exposure are the first two things that we can do, is to just talk about what is normal bleeding and what is not normal. And just really, it seems sometimes like this should be, stuff that we would all understand, but, the human mind has an amazing capacity to avoid doctors. So,
I believe that's going to be the quote of this whole KP Canada conversation. Right?
yeah, people, it's scary when you don't know what's going on in your body, and it's something that if you are already hesitant to seek care, that this is something where you might try to ignore the symptoms. And so I think educating our patients and also letting them know that this doesn't mean that you have to have a hysterectomy.
Mm-hmm.
I think a lot of women, and particularly women of color, think that because traditionally that's what was told to them, is that you need a hysterectomy. You need to get rid of your uterus. And that's just not the case anymore. We have the ability to really impact quality of life and treat these tumors and keep your fertility intact.
Do you get emotionally connected to your patients?
Absolutely. Absolutely. And I feel for them because, I know that we are, that we have the technology to help them and that we could have helped them years ago. Mm. But instead, just this week, I had this wonderful, lovely patient come in, 32 years old, massive fibroids, needing blood transfusions. And, she's just the sweetest person who never wanted to complain. And my heart goes out to people like that because, they don't want to complain. They try to just manage on their own. And there's just, there's no reason when medicine has the technology and the capability to help you.
Are you somewhat amazed at how far we've come with this, that we can do it this way?
Yes, I am. In part because I remember being a medical student in Chicago and seeing, the first robotic surgeries being done at my medical school at Loyola Chicago. And, these surgeries were taking like 10 hours to do a very simple, straightforward hysterectomy because it takes a while to understand the technology and to adapt. That learning curve is very sharp. The technology is amazing. I mean, it offers you magnification that is 10 times that of the human eye. Mm-hmm. So I can really zoom in and see up close and personal what I'm operating on and where the vasculature is. And I can make very precise incisions, and my instruments rotate 360 degrees. I mean, the technical capabilities with robotic surgery just far exceed that of laparoscopy. And it's come a long way. We're able to do these very complex surgeries in just, a matter of a couple hours even or less, and patients go home.
Would you say that the future of surgery in general is going this direction?
I think for certain indications, yes. We are seeing robotic technology being used by general surgery. Cardiothoracic is using it. Urology uses it extensively. So all the specialties are seeing the advantage. I don't think that it's necessarily needed for all types of cases, however. I would say that, saving this to really be applied to patients who really need it is probably the future.
And how do you feel when you have a patient who came in with absolutely the worst fears of what this was going to be, and they end up having, they're able to keep their reproductive organs intact? This was a relatively mild experience. Yes. I assume that there is this gratification that you have.
Absolutely. It's very humbling for me because I get a lot of thank you notes, a lot of tears and hugs, and just a whole bunch of appreciation from patients that are amazed that we can do this. And, I always tell them, I said, just your gratitude is, all that we need. Like, that's just so personally and emotionally satisfying for me. I just, I don't need anything else in that. And they just can't believe that we could just do this and just make it that simple and straightforward. So I get so much satisfaction and happiness when I see that. And then, I have patients come back pregnant. I have a woman who I took out a tumor. Again, it was bigger than this. And she was in her early 30s, and I'm going to do her C-section in 2 weeks for her first baby.
That's so wonderful.
Yeah.
That's so wonderful.
Yeah.
Dr. Meredith McMullen, you are a pleasure, and we are so fortunate to have you, and thank you so much.
Thank you. Thank you. I'm fortunate to be here. I appreciate it.